Good afternoon. Welcome to 5 Minutes with Nurse T. This is Tarnesa Martin, a Hurley Medical Center nurse. Get it, Nurse T?
Hi, everybody. This is Tarnesa Martin, patient resource and community advocate. I do work for Hurley Medical Center, been here 19 years, grinding, caring for patients. So glad to have this opportunity to just come on for a few minutes and just talk about what's going on in the community and keeping the community updated. I have joined COVID-19 webinar. It shows on every Friday at 12 o'clock. It addresses a lot of issues and concerns centered around COVID. It gives a lot of data and it shares a lot of information and resources about COVID. So if you're able, please join in on Fridays at 12 o'clock. But if not, I'll be able to update this group about the information that has been shared. I know one concern was mentioned, if we just be honest and real and transparent, is where was everybody at when we had diabetes and nobody cared about us having diabetes. But now that COVID hit, a lot of people want us to take this COVID vaccination. The COVID vaccination is an extra layer of protection. I'm not here to force you to take it. I'm just here to update and give you information and to let you know that I did take that question and that concern back. And they did provide me some data that I'll be able to show at our next coming meeting in August. Last month, we talked about stroke and being familiar with the stroke signs. A couple of the members of this committee, of this team, had experienced stroke and was able to speak to it and how they survived. So making sure that now it's hot, making sure you're staying hydrated. If you're having any kind of chest pressure, any kind of headaches or anything, making sure that you get to the medical center. Another thing that's been going on in the community is Man Up. I know Man Up is a community group and they have been talking about gun violence. I wanted to share that because they've been having like meetings throughout the city. I was able to speak at one of those a couple weeks ago about being that at-risk teenager and knowing the importance of violence, and speaking from a perspective of a mom that's raising a son, and also a mom that experienced her son's friend die too early because he got hit by gun violence. So I just wanted to share that if anybody in the community or anybody that we are connected to is experiencing any kind of trauma or anything from their loved ones being hit by that Hurley does have a trauma recovery center that's free to Genesee County, so where you can get counseling, and it focuses on victims of gun violence, violent assault, family violence, and elderly abuse. So I just wanted to be able to highlight this resource. You can reach out to me at 810-262-6100, or you can email me tmartin1@hurleymc.com if you want any information referencing this. Just real quick, I'm about to end. I just want everybody to know that I'm in the community. If you have any healthcare concerns, issues, or questions as far as education, how we can help, just let me know. My goal is to help identify the health disparities and those silent killers that I call them, which is the heart failure, the stroke, the diabetes, the COPD, and the end-stage renal disease, really making sure that our community is educated on these medical conditions because they are preventable, treatable, and manageable. So I want to do a lot of education centered around there. So I'm really looking forward, really glad that I'm part of this group to be able to be access for resources and to be able to be that one-on-one contact with you. So if you need any assistance or any questions, if I don't have the answer, I can find out the answer. And if you need a resource and I don't have it, I can connect you to the resource that's available. So been very busy out here in the community. I appreciate this time. So it's glad being able to connect. And I'm so glad that we are finally connecting and connecting as a community, and that I'm able to bridge the gap between Hurley Medical Center and a community, because we really want the community to know that we care. But most of all, I really want the community to be safe, be wise, be knowledgeable about healthcare concerns, and try to help dispel some of the myths and the barriers, and break up some of the mistrust that we have with our healthcare systems across the nation. So once again, I thank you for this time. I appreciate everybody that's on the call. Miss Jerry, Mr. Patrick, thank you for having me. And I'm done. This is Nurse T. Thank you guys so much. Stay safe, stay healthy, and stay wise.